everyone. I know that the gait is a bit difficult topic and even more difficult if we are talking at the end of the day. So we will try as much as we can to make it simple, because I'm satisfied that if we understand well, so we can simplify well. So today we are going to talk about the fundamentals for the clinical gait analysis for the physiotherapist. However, I know that we have many other orthopedic surgeons as well as neurologists, so we will try to figure out the basic inputs that we can get from the gait analysis. Freeman was one of the figures in the pediatric orthopedic surgeons, and in 40s almost and 50s, he mentioned that it's obvious that any kind of improvement, either in the surgical or physical therapeutic procedures, braces, orthosis, must rely on an accurate knowledge of the functional characteristics of the normal locomotor system. Almost 50 or 60 years ago, later, Jim Gage, another pioneer in the gait analysis in the pediatric disability, mentioned that involvement of the individuals from multidisciplines, including neurology, neurosurgeon, pediatrist, physiotherapist, mechanical engineering, and orthopedist, they are very essential to cope with, to try to understand the complexity of the gait. So what do you think about clinical gait analysis initially if we mention this term? Many of the people think this is pure academic, this is pure for the research activities. However, the first point called clinical, that means it's for us as the clinical practitioners. So we can summarize that the clinical gait analysis definitely is a sort of instrumental measurement. We may have a sort of high-tech if you have a very fancy 3D gait analysis. It may start with a very simple observational way. Definitely we have a sort of standardization for that, which is very nice. So wherever we are in the Middle East, in America, in Canada, in India, we have a standard for the normal walking. It's by this way, an objective way, it had an accuracy, and used in the clinical for proper decision making. So, however, the instrumental gait assessment is the gold standard way for the analysis, but we know that a laboratory gait analysis is very difficult, not only for the financial issues, but it needs many disciplines working together, and this is not easy to be available in every place. So let's go for the why we are going to conduct clinical gait analysis. What is the add value for us as a clinician? We have a different perspective. We may try to figure out the issue of deviations. We may are interested to identify accurately the impairment. We may need to understand how the patients are executing the pattern by this way, or we may need to monitor the outcomes of our intervention. So if we keep